Welcome to You and Your Pets. I'm Jim Horton, and I'm here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and a special guest, Dr. Meg Mullin, who is an equine veterinarian who specializes in sport horses. Is that correct?
That's right.
And of course, you have with you
Lucy.
Lucy.
My traveling companion.
Lucy is your traveling companion. So let's get started. What made you decide to become an equine veterinarian? First of all, you probably had a lot of different choices you could have gone into. Is that not correct?
Absolutely. I was always drawn to horses from a small girl, and every major decision in my life had to do with me riding, me being involved with horses, and eventually I took a job after college riding and training, and that's what led me to say, wow, I could have been a vet. And then I said, oh, right, I still can. So I did.
So there are a lot of veterinary schools in the United States. Where did you go to veterinary school?
I went to University of Pennsylvania in Philadelphia. That's where I'm from.
Okay, that's very good. And they have an extensive equine program there?
They have a very, very good equine program, yes.
Other than Lucy, do you have any horses yourself?
I don't have any horses at the moment. I have Lucy and I have a cat. And they go with me everywhere, not the cat.
It's interesting that most equine veterinarians do have a dog, and a lot of the dog are Jack Russells. And it's just funny to me that this is an Irish Jack Russell, and Dr. Mullin works for an Irish veterinarian, so it seems to be rubbing off downhill there. But they're great little companions, and they're good to have in the truck with you.
I neglected to mention you are with the B. Furlong Group in Clinton, New Jersey. Is that correct?
Brendan Furlong and Associates. We're based out of Oldwick, New Jersey, which is right near the United States Equestrian Team.
Okay, and I'm assuming you spend a good deal of your time with the equestrian team?
We have a lot of clients that have gone to the Olympics, that compete in world championships in multiple disciplines. Brendan was the eventing team veterinarian for 4 or 5 Olympics. I've gone to world championships with driving horses. We do upper level show jumpers, dressage. I have a lot of very good dressage clients. We also do the hunters and the equitation. Anything that involves going to a ring and competing.
Right. I just want to interrupt here and say that Dr. Furlong's practice is one of the leading edge equine practices in New Jersey, and surprisingly there are several of them in New Jersey. You'd expect them to be in Kentucky or Florida, but they are here in New Jersey. It's one of the cutting edge practices, and as we'll see later, there's some excellent technology that goes along with being an equine veterinarian, other than the old cowboy of grabbing them, roping them, and branding them.
Yeah, let me ask a question along that line. I don't want to jump ahead too far, but when you said a leading equine practice in New Jersey, I got the impression before we went on that some of the things you're doing are actually leading in the United States. Is that not correct?
Absolutely. We were one of the first practices to have digital radiography, shockwave therapy, and now we were also one of the first to do a standing MRI for the horses.
So, so you really are on the cutting edge.
Absolutely.
Right. Give us an overall perspective on the differences in the medicine that you're doing with a large horse and, say, the medicine that Dr. Rogers would do with a dog or a cat. Other than the size of the animal, what are the differences we're talking about?
Well, horses go lame. And dogs do too. But it's one of since we ride them, it's very important that they stay very sound and competitive. So one of the biggest parts of my job and of our practice is to keep the sport horse in the show ring.
Well, let's take an example. Let's say a horse with a 4-limb lameness. You're going to work it up. And then I'll tell you how we do the same thing in a dog very briefly. So a 4-limb lameness in a horse comes in, it's limping on its front leg, and you would do?
We do a nerve block. Well, first we'd palpate the leg for swellings.
So feel the leg for swelling and
feeling the
hop.
leg. We'd also put some hoof testers on them to see if there's any sensitivity in the hoof. As you know, it's a very hard cornified structure, so you're not going to be able to palpate anything with just your fingers, so we use metal hoof testers. We feel the leg for any heat or pain or swelling. We, of course, watch the horse jog in a straight line in circles. We also flex their limbs. So we pick up their limb and we flex the lower limb or the upper limb, and then we watch them jog off after that to see if the pain is worse down low or worse up high. And then we take it to the next level, which is to do nerve blocks. So we actually go and block the nerves that go down to the foot.
A nerve block prevents the animal from feeling below the nerve block. So if there's a problem in the hoof and you block the foot or you block the leg up here, the animal will then not feel the pain and will be what we call sound or able to walk normally. So that's what a nerve block does.
Okay.
And so in a small animal, when we have a forelimb lameness, I will have the animal come in and put it up on a table, and I'll bend all the little limbs, all the little joints, just as Dr. Mullin would do. And then we have the animal walk around and we see if there's any more problems. So it's quite similar. The difference is my 50-pound dog isn't going to kick me in the head and kill me, whereas her 1,200 to 1,800-pound horse is going to kick her in the head and may cause some serious damage.
That brings up the issue. You're dealing with championship horses. I suspect some of them might be high-strung.
Mm-hmm.
And all of a sudden, and they're hurting, and all of a sudden you come in the stall and the horse isn't particularly eager to see anybody, much less a human. How do you keep yourself safe?
Well, you don't always, but there are certain precautions you take, and the first thing you do is you assess your patient. You have to look at them, just as you would look at the dog. Is that dog going to jump and bite me, or is he going to let me walk up to him and touch him? And so you have to, gauge your patient. There's certain ways that you approach them, places that are safer to stand than other places. Being near the head is always safer. Then you have people help you to hold the horse. And if they're holding the head, you want them to hold the head from the same side that you're standing on, because you always want the head towards you. In case if the horse moves, the head should stay towards you, so the tail end goes the other way. There are twitches that we use, and people say, "Oh, that's cruel."
A twitch is basically a stick with a rope at the end of it that you put over and sort of tie up their upper lip, but it just gets their attention and lets them know that you're there.
And it also releases endorphins. So as it takes effect, you can actually see them relax a little bit. But it's surprising at how well it makes their feet stay still and makes you able to control them for the most part.
And Dr. Mullin's being, I guess she's being less than proud about what she does, but realistically, it's walking in and looking at the horse. The horse's ears, are they back? Are the horses fidgeting? I mean, that's something that I've lost in 20 years of doing small animal practice, that I could very easily be killed if I walked into a horse stall and not know it, whereas Dr. Mullin has this sense, and it's not necessarily obvious to her. She just walks in and says, "Oh, there's going to be a problem here. Let me step back and reevaluate." So I think that's something that an equine veterinarian has.
So to use a cliche term, you have horse sense.
Yes. Absolutely.
But you have, I think you mentioned before we went on the air, that you have been injured on occasion.
Yes, I was injured. I had my leg broken, and it was a horse that was partially sedated. And I was actually going in to assess the sedation, and it startled him. He woke up and he knocked me down and came after me with his hind feet, and I broke my leg.
So it's not a danger-free occupation under any circumstances.
No.
In the time you've been in the field, how many years have you been a veterinarian now?
I graduated in 1996.
1996. Mm-hmm. How many major changes have you seen in the field since you graduated?
Oh, wow. The digital radiography has to be the biggest. We used to have to take your radiographs, your x-rays, and put them through a developer, liquid, and let it dry, and then you would put it up onto a viewing screen. Now it's all computerized. We've gone from having multiple plates to having multiple plates where you take a radiograph and x-ray and you bring it back to a central computer. It's still digital. And we even have what's called direct radiology, which is a plate that's connected by a cord or wirelessly right to the computer, right there, you see the picture as you're taking it, and you can say, oh, I've got what I want on that, and I can move on, as opposed to having to come back and wait and make sure you have all that you need to see. And that's been the biggest advantage, and it's very user-friendly.
Very computer oriented now.
Yes, it's everything's computerized. We also have a lot of biological modalities that are available to us. We can use stem cells now.
Stem cells are cells that are universal cells in the body that can be used to be placed in different parts of the same body or another body that will help develop whatever injury or help correct whatever injury occurs. So go ahead with stem cells. What are you doing with them now?
Well, the stem cells, we're using them in tendon and ligament repair, in joint repair. So if we have an injured cartilage or meniscus.
That's in the knee. The meniscus is one of the pads in the knee.
Then we're using stem cells to try to regenerate that, because nothing to this point helps. Once that's damaged, it's damaged, and there's no more cartilage that's going to be made. The body will heal it with a little bit of fibrous scar, but when the cartilage is gone, the cartilage is gone. So that's one of the things that we're trying to use. We're also using PRP, which is platelet-rich plasma. That's a blood product. And we're using IRAP, which is also another blood product, and that's just upregulating the body's own natural anti-inflammatory cells.
So by upregulating, we mean stimulating, stimulating the body's own natural process of healing.
And that's also from the blood, and we use that mostly in joints. And then we also have, just short of stem cells, is bone marrow aspirate concentrate. Well, that's where the stem cells live, in the bone marrow, and we don't necessarily have to grow the stem cells and use them specifically, but we can just use that concentrate, and it has some stem cells, it has other properties that are very good for healing.
So, in other words, if I could summarize, a lot of these technologies and biologies are being used with humans as well. Is that not correct?
Absolutely.
So it really, the transference, or maybe, I don't know where it started, whether it started in the animal field or in the human field, but either way, it's transferring across from one branch of medicine to the other. And
I would be remiss if I didn't mention the standing MRI. And in people, as you know, it's a size-limited machine. If it's totally enclosed, well, that limits what you can image in there. And since the development of a standing MRI, we've been able to use it on horses without doing any general anesthesia, which is risky to the patient.
Right.
So we're able to just stand them, sedate them, and get images that we've never been able to look at before, which has just been it's revolutionized sports medicine.
Okay, we've got to take a break. We'll be right back after this brief pause, and we'll talk some more with Dr. Mullin. I'm Jim Horton.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and our special guest, Dr. Meg Mullin, the equine specialist, veterinarian specialist. And Dr. Rogers, would you take over the questioning at this point in the show? Because I think there's some very interesting things that you would like to talk about.
Well, I think Dr. Mullin brought up in the last 15-minute segment about MRIs and about some of the new technologies that we have. And we're going to now look at some of these, and I think they're interesting. I think, to me, I graduated in '91, and since I graduated, the methods of sedating horses and being safe around horses has changed significantly. And so now they do standing nerve blocks, and they do standing anesthesia or standing sedation. So just tell me what you sort of do. I don't need to know the specific drugs, but basically you'll walk in and you'll put a catheter in an animal, or do you just inject them? Or?
We do many things just by simple IV injections. If we have to do a procedure on a horse and we need them to be sedate, we have drugs that will make them very sedate in 5 minutes and leave them standing, but still and quiet,
right.
and very easy to deal with.
Right. And so when I was in school, sometimes we actually had to lay them down, and you don't want a 1,200-pound horse falling. I also did a residency in anesthesiology, and so we had quite some challenges with some of the newer anesthetics, particularly sevoflurane, where they got up too quickly and they were still stumbling. So I appreciate what you have to go through just to do some of these tests in veterinary medicine. So once you've come into the barn, you've decided what your patient needs and you've sedated that patient, you'll then go on to look at certain things in that animal. And as I said before, I'm not sure if this always holds true for all veterinarians, but a lot of what equine practice is today, at least for you in sporting animals, is orthopedics or bone work. And so here we have maybe not one of your patients, but a patient and a sporting animal. And can you just define what a sporting animal might be as opposed to a pleasure horse or a work horse?
A sporting animal is one that we take into competitions, be it over jumps. This is an eventer going over a beautiful flower jump on a cross-country course. A hunter that's going around in a show ring, looking pretty. A dressage horse that's basically doing ballet on the ground and being very magnificent. Like
the Lipizzanas?
The Lipizzanas, absolutely. Well, the most of our practice consists of the hunters, the jumpers, equitation, eventers, dressage, and driving horses. That's the majority of our clients. So we do also have pleasure horses and people that are just happy to have them in their backyard and right. pat them on the head, and that's good enough.
So then we'll move on to, you'll walk in, you'll see a horse, the horse is lame, either in the rear, as we talked about, or in the front, as I do with my animals, and I grab my 50-pound dog, put him on a table, and if I have to, I'll knock him out and then turn him on his back and take an x-ray. Now, you can't quite do that, but here is an example of an x-ray now. On our right, the actual left of the screen when you're facing it, is a regular x-ray. That's an ordinary x-ray. Can you tell me what the difference is, please?
Oh, well, the difference between digital and regular x-rays, it's much clearer. You get more definition of the bone, and it's adjustable. It's much more user-friendly as far as getting the image and not having to go back and repeat it because the technique was wrong. So it's much more detail-oriented. We see crisper edges and more definition of the bone itself.
So this makes it a little easier to tell about lameness and lesions and sores and everything. Can you see soft tissue with this as well?
Not very well, but you can see some. You can see outlines. You can see when there's a swelling or an increased density. Every once in a while, you can actually see the outline of a tendon down the back of the leg, but it's just a faint outline. It's not the modality or not the thing you'd want to use for soft tissue. And
so then you'll move on to
right.
to look at something else that might be a little bit better to see with soft tissue. And so we can look at something called ultrasound. Mm-hmm. Now, we use ultrasound in small animal practice all the time. We look at it to look at the belly and look at the chest.
That's right.
We don't use it to look at the legs very often, and mostly because the amount of tissue around the legs is so dense that you get too much reflection of the sound waves. But in horses, it's a slightly different thing. And again, a horse, as far as I can tell, is on 4 legs, and if a horse doesn't have all 4 legs, it's not very useful.
That's true.
So when you do your ultrasound, now this is one of your colleagues with an ultrasound machine, and so what are you doing when you look at the soft tissue with an ultrasound machine? What really are you looking for? You're looking at the forelimb, the hind limb?
Well, it can be used, we use it in the same method you do for internal structures, which is where this is a big hospital one. It's being used to look at the abdomen of a horse. And when you're looking at the leg of a horse, you're looking at you want consistency in the tendon or the ligament. You don't want holes, you don't want it to be bigger. So you're looking at size, shape, and homogeneity.
Whether or not it's consistent
Right.
throughout the thing. So you can tell soft tissue with this, but what about bone? Can you tell?
You can see the edge of the bone. It will not penetrate bone, but you can actually see the edge of it, so you could see a break in it. So if there was a fracture and you were ultrasounding that area, you'd see a break in the bone.
And what about the tendons? Because tendons are as important to bone as bone in
That's right.
a horse. And from what I remember, my little bit of equine knowledge, which is very little bit, it seems to me as though horses have as much problem with their tendons and ligaments as they do with their bones.
Absolutely. Since we run them and jump them and ask them to do beautiful maneuvers under saddle, they get sports injuries just like we do. And they get bowed tendons, and that's an inflammation of a tendon, and they get strained suspensories, and they have really in the lower half of the leg, it's bone, tendon, ligament, arteries, and veins. There's not a lot of muscle, and that's the horses develop that way. All the muscles above his knee or above his hock, it's in the upper leg, so he can be faster and run. But it's just tendons, ligaments, and bone pretty much in the lower limb.
And then we have another person here, I think that's you, with your little friend, Lucy, who is your assistant and obviously helping here. And you're looking at, looks like the tendons of the forelimb.
That's correct. That's correct. And that's a wonderful client of ours. She's a 5-time Olympian, and that's just some of the people we get to work for, being in this beautiful area.
And so what competitions does she do in the Olympics? I mean, this is just fantastic that you do this.
Yeah, jumper rider. We have that I believe is a jumper.
And that's why it's so important that his forelimbs are sound.
Absolutely. When they come off of a 5-foot fence and land on 2 feet.
Right,
They-
1,200 pounds plus the rider on 2 feet, right. It can be a little bit challenging. So you actually go to the barn, unlike I have all my animals come into me, I grab them. But in a small animal practice, it's fairly easy to keep all my equipment around. Now you go to different farms, so how do you get back and forth with all this equipment?
Well, we have SUVs. Some veterinarians have trucks, with truck bed and a box. But we travel with SUVs, and we have a big medicine box in the back. And in the back seat, I can have anything from a shockwave machine to a digital radiograph machine, an ultrasound, and so on to treat the horses and to investigate.
And so what would you use your shockwave machine for?
That's another healing modality. We use it on bowed tendons, suspensory ligament tears. We even use it on joints to ease the pain.
And so shockwave is sort of like ultrasound with steroids. and what does that actually do? Does it relieve the inflammation? Does it relieve the pain, or does it do both?
I think it does do both. It works with getting the cells, getting the body to respond in that area and to come and just to stimulate it to heal there.
Stimulate the blood flow to the
Exactly.
area and relieve some of the inflammation.
And it also has a soothing effect. So they do get a little pain relief from it as well.
Excellent. And so let's go on to our next picture. And this is what you were talking about previously, standing MRI. And though this is a little dark for us to look at, I'm sure it'll project well on the screen. But we have a horse standing with his foot in a blue horseshoe, so to speak, that goes around the lower part of the limb. And this is an MRI. It's a new innovation even in human medicine. And so tell us about this. This is something you carry with you, or does the horse have to come to you?
Now for this, the horse has to come to us. And the horse is just sedated, mildly sedated, so that it stands still. And they run a series of studies, weighted images, and it's a coil about that high. So you can only look at one area at a time, and the patient has to be very still. So it's most efficient and effective down at the foot, which is great because we didn't have very many ways to look at the soft tissue structures in the foot. And what the MRI is superior at doing, it shows you all the tissues. It shows you soft tissue, and it shows you bone, and it can show you the character of the bone. It can show you edema or swelling, bruising of the bone.
I think we have an example here.
Yes.
And that is an MRI of the foot of a horse. And I mistakenly thought there was something wrong, but apparently it's a normal hoof of a horse, and fortunately I don't have to see horses. So just quickly we'll go on to the last, or one of the last techniques that you use, and it's called technetium. And technetium is a drug that's a radioactive drug that's injected into the horse, and then you allow the horse to emit the radioactivity, and you take a picture of it. So tell me what you might use that for.
This is this is nuclear scintigraphy, and it's used in human medicine as well. And the radioactive isotope that we inject into a horse, the technetium-99, binds to bone that's really active. So it'll show up if you have a stress fracture and it's not visible on an X-ray. It will show up here, because any bone that is actively metabolizing, this is going to go right there and stick to it.
So I think these techniques make the point that veterinary medicine in particular, but equine medicine in general, is much more a sophisticated process than we previously thought, and it's akin to human medicine or small animal medicine. Mr. Horton.
Yes, I would be curious to know, given all these technologies and given the kinds of clients that you have, what is your favorite area of work? Do you have anything particularly that you really like to do with these animals?
Well, my favorite part is getting the horse to the ring, and that's just the keeping it, working with it, the trainer, the horse, on a regular basis. So examining it before it goes to competitions, and making sure it's ready to compete. It's at its top performance, and we have several things that we do to help them stay there. But it's wonderful to work with these competitors that know their horses so well, and to be able to keep them happy and healthy and in the show ring.
And care about the horse.
Yes.
And you do travel with them.
Yes.
And if I understand correctly, this is over a good part of the world,
Yes.
right?
I've traveled to Australia, Mexico, Europe, with the horses. Yep, Canada. Spruce Meadows.
Mm-hmm. Okay.
Thank you.
We've run out of time. I want to thank you very much for spending your time with us tonight, Dr. Mullin.
Thank you for having me.
This is You and Your Pets. I'm Jim Horton with Dr. Ernest Rogers of the Maplewood Animal Hospital. Thank you for watching.